is taking place in other hospitals.
A leading anaesthetist from the Royal United Hospital in Bath says lives could be saved if there was better allergy testing for patients. Now, antibiotics have been identified as the main cause of potentially life-threatening allergic reactions during surgery.
As our health correspondent Matthew Hill reports, the findings also raise questions about the safety of private hospitals in dealing with patients who have these rare reactions.
Anaphylaxis in the operating theatre is a life-threatening drug reaction that happens suddenly and without warning. In extreme cases, it rapidly progresses to cardiac arrest or even death. Caroline Leach from Cheltenham came to London to take part in today's conference on allergic reactions to anaesthetics. Her attack happened when she was being treated for asthma.
That I actually had a full-blown anaphylactic shock to one of the muscle relaxants. It took me a good 6 weeks really to fully recover from it. It doesn't sort of wipe you out really, but I was very lucky actually, because I wouldn't have known about it had it not been that the anaesthetist who was called in to help me out with the crash call was actually an anaesthetist that I worked with in maternity. So she actually told me that what happened, otherwise I was completely unknown. You know, I actually didn't know what happened.
This 4-year study explored allergic reactions during anaesthesia in more than 3 million operations. Out of several hundred life-threatening reactions, there were 30 cardiac arrests and 10 deaths. Once the patient is identified as allergic, an alternative anaesthetic must be found. But waiting lists for allergy clinics to find this out are on average more than 3 months, when they should be no more than 6 weeks.
1 in 5 people who are in hospital believe they're allergic to penicillin, but we also know that 90% of those patients aren't in fact allergic to penicillin. And what we did find was that a significant number of the severe reactions were caused by antibiotics that were given to avoid penicillin allergy, particularly a drug called teicoplanin. So if we could better identify those patients who genuinely are penicillin allergic, and particularly those that aren't, we could give penicillins, which are better drugs, to those patients, therefore preventing the risk of those serious, unpredictable reactions.
3/4 of those patients who have anaphylactic shock should be taken to intensive care. The problem is that at the moment only 1 in 5 private hospitals have an ITU, and not enough of them responded to this survey for them to find out whether what they were offering was safe. The Royal College of Anaesthetists are calling for more allergy testing clinics for people thought to be at highest risk if lives are to be saved. Matthew Hill, BBC Points West, Bath.